No, I'll come where you're at.
Okay. Cool. All right, nice. I'm gonna press our button and slide out of the way.
All right. I'll just kneel down right next to you.
Great. Okay. You ready? All right.
Good morning. We are here at Naval Medical Center Portsmouth. Had the opportunity to visit here today. I'm Congresswoman Elaine Luria from the 2nd District, and over the course of the last week have had the opportunity to visit our medical providers all across southeastern Virginia, up on the eastern shore, on the peninsula at Riverside, on the south side at Centera, as well as the Hampton VA yesterday and Naval Medical Center Portsmouth today. So really wanting to understand and get the word out to folks about what to expect. If you do need to see a healthcare provider, and if you do have symptoms that you think you might need to be evaluated, screened, and potentially tested or treated for COVID. And so it was a great opportunity to speak to the leadership here at Naval Medical Center Portsmouth today, to be able to talk about some new procedures they've put in place. So for anybody who routinely comes here to Portsmouth or one of its branch health clinics and needs to be seen here at the emergency room, what you can expect starting now from 10 till 7 every day, they'll be doing a drive-through screening. So if you're headed to the emergency room, the first thing they'll do is you'll roll down your window and they'll say, "Why are you here?" So if you have a child with a broken arm or something that's not in any way related to a respiratory illness, they will send you on your way and you'll get treated immediately the way you always would at the emergency room. If you do have any of the symptoms, specifically a fever, shortness of breath, or a cough, they'll ask you to pull over, do some additional screenings there, and then try to determine if additional measures are necessary as far as COVID is concerned. What they're trying to do is keep the flow of people coming through the door of the emergency room down, to prevent spread, to prevent have larger groups of people, and to be able to reserve the resources of the staff and the equipment that they have and supplies here at the hospital. So if you do pull up, you get to talk to a corpsman, a nurse, a physician at that first screening, and they think that you don't need to be tested for COVID and you have some of the normal cold symptoms. And you're in the military, a cold pack. They'll give you those common over-the-counter things without having to go into the pharmacy, and then give you guidance to check up again and check in with your command about what you should do next. But it's not business as usual at Portsmouth, but it also is. They're just trying to make it safer, really, for the healthcare professionals here, because it's very important that all of the healthcare professionals themselves stay safe and don't contract the virus or spread it to other people. So they want to ask you some simple questions, send you in the right direction, and provide you the best care as soon as possible. They do have the test kits here. They send them off to a lab like many of our other facilities do, and that takes a several-day turnaround. They have conducted some tests here at Portsmouth. And again, like in the other times that I've had an opportunity to talk about this, it's the screening process, so talking to a healthcare provider, getting those questions answered. And that's the same if you see a military healthcare provider or if you go out in town to any of our other medical offices, hospitals here in Hampton Roads. Make sure you call first, answer those simple screening questions. And was at the VA yesterday. Same thing will happen when you walk through the door at the VA. They'll ask you some simple screening questions, and then they'll send you in one direction or the other based off of what type of further evaluation that you need. And it's great to be able to talk about how military medicine is handling this, and what service members should expect. And I think there's some folks here who would like to ask questions, so I'm happy to take those questions.
Just as someone who is in the Navy, you've been touring all kinds of civilian hospitals. How important is it, you think, that the Navy hospital is also doing what it can to prevent the spread and give people those options of just driving up?
I think it's incredibly important. Here in Hampton Roads, we have so many military, so many veterans who receive their health care here at Portsmouth or one of the satellite clinics, or maybe have the option for multiple places that they could go, to know that anywhere they go in Hampton Roads, that there is a plan in place and there is screening going on, and that they will get the right kind of care and directed in the right direction for what type of symptoms that they're showing.
Have there been any cases of COVID-19 at Portsmouth Naval Hospital?
There have been 3 cases that were tested through Portsmouth that have been identified. Those are already amongst the cases that have been reported through the Virginia Department of Health.
Those were positive cases?
Yes, and more were screened as well, but negative.
And then you mentioned yesterday, and I wonder if you guys had a chance to talk about it today, the fact that for the USNS Comfort to staff that ship, some of those personnel are going to be coming from Portsmouth, they're going to be coming from other military hospitals. Is there a staffing plan to make sure that everybody is still able to function at the highest capacity possible?
There definitely is, and actually Admiral Swap, who's the head of Navy Medicine East on the whole East Coast, gave the good news today that a lot of corpsmen and medical professionals who are reservists have actually been calling in to volunteer. And so they are taking each of those calls, and they will do their normal manning plan to take the personnel from Portsmouth who man the Comfort, and this is something they practice, rehearse, have gotten underway with the Comfort several times in the last couple of years to execute this. They will execute that plan, and some of those reservists who are volunteering, corpsmen, medical professionals, to come in and fill up the staffing, backfill them at Portsmouth, are going to be able to activate to do that. And so they don't expect to see any significant change in the service here, but like every healthcare facility in Hampton Roads, they're really trying to focus specifically on making their efforts towards COVID, patient screening, testing, treatment, and if people have routine healthcare needs, they should call their healthcare provider, see if they can handle that via phone call, telemedicine, and for electives and routine surgeries that can be delayed, they are going to postpone those for the time being.
I noticed the blue tents back there. Were you able to get a look at kind of the setup that they have, and what did you see? What did you think of it?
I did. Well, first of all, like any Navy or military thing, it's very organized. They've got a whole system set up, and I described it a little bit earlier, but if you come and you need to go to the emergency room, if it's something not at all related to COVID, say you bring a child who might have a broken arm, first question asked, I brought my child, they fell, they need to get an x-ray, they'll send you right to the emergency room, and then they have two separate sections to drive up to park. They have medical equipment out there to take people's temperatures, to provide over-the-counter medicine. If people do have cold-like symptoms, then they don't need to be treated or tested immediately for COVID. They really seems like they've thought through it all. They just kicked it off today, and I'm sure that as they go, they'll continue to refine it and make it work smoothly for people. But they're running that from 10 till 7, so those are the peak times when they expect to have people come to the emergency room. If you come to the Portsmouth emergency room outside of those hours, you'll just go to the normal entrance, and there will be a screening there as well, but the tents are just designed to provide some additional capacity and keep people out of the emergency room when they can be treated another way.
So yesterday it came down that U.S. hospitals and medical professionals are asking for $100 billion from Congress or from the government in order to help combat this. Is there anything that Portsmouth Naval Hospital is telling you that they need from the government or funding? What does that look like?
I think within DoD, I have not gotten any specific requests through Portsmouth for more DoD resources or through the VA. The Hampton VA, that on the ground they need any additional resources through DoD or the VA, but we're constantly in contact, and I'm on both the Armed Services Committee and the Veterans Affairs Committee, and certainly want to hear those needs from our local providers within the DoD and VA healthcare system, and pass those on. But this is definitely something that is using extra resources, and I know that the leadership here is specifically trying to keep track of the costs of additional supplies, personnel, everything they need to do to help with COVID. And in our upcoming funding packages, I know that we will look at both DoD and VA medicine and determine that they get the resources that they need to cover the costs of this emergency.
How are the level of testing kits available here? Are they okay with what they're dealing with now? Are they feeling a shortage at all?
They have more on order, so like everywhere in the country, there are not unlimited testing kits. The feeling I got from Naval Medical Center Portsmouth is that the kits that they have on hand right now are keeping up with the demand that they have right now. But like I said, they do have orders that they're waiting to be filled. And DoD is a big medical system, so they are able to share resources with other facilities to try to get more if there is a shortfall in those.
Have you heard anything about triage plans or field hospitals or anything like that as far as it comes to military medicine and that capacity?
Well, we've talked about the Comfort, so that is one of those things where we will bring up a military healthcare capability and deploy it to an area that has a higher need. The personnel here at Naval Medical Center Portsmouth, since the Navy and Marine Corps medicine corpsmen are the same, some of the personnel assigned here are assigned to support Marine Corps deployable medical units as well. So they're already looking at if those units were to be activated, which personnel would support those and how they would backfill that. So I think that across all of DoD, there's planning with every unit that has a medical capability and how it could potentially be used if that need arises.
I just in the last few days, it seems like a lot of states, and here in Virginia too, we've been getting a lot more cases. Confirmed cases. Do you think it's because we're just getting more tests back, testing is more available, or is it spreading a lot more quick, you think?
I think it's both. You know, here in Virginia, we have 94 cases as of yesterday's report. The State Department of Health puts those out at noon. And 20 or so of those are roughly in the Hampton Roads area. We do know that in Virginia there is community spread, and we do know that within Hampton Roads on the peninsula there's what's considered to be a hot spot, so a geographic concentration of multiple cases in one particular location. And you know, because it is so communicable and because there are people who have been exposed and don't show any symptoms, the spread is inevitable. So it's not a question of if, it's a question of when that we're going to see more cases rise here in Hampton Roads. And I know that, you know, amongst all of the healthcare facilities that are testing, because that test takes 4, sometimes 5 days to come back, we could, you know, potentially start to see rising numbers based off the increased number of tests that have been administered. But the really important thing is that people stay home if they're sick, follow the CDC and the governor's guidelines about the size of groups that can congregate together. And the really seems so simplistic, but you know, wash your hands, use hand sanitizer if you're not able to use soap and warm water. But the social distancing is critical to stop the spread, and something that I just want to continue to share every time that I'm able to talk to people is that every one of us has the same ability to help stop the spread of this disease. By following those guidelines, by social distancing, we can each do our part, and each of us do the same thing to help the community to stop the spread. And the main thing we don't want is to see our healthcare system overwhelmed. You don't have to look very far to New York, to California, to places right here in the U.S. now where that is starting to happen. And you know, we've heard it about flattening the curve by making sure that the spread doesn't peak immediately, but we can, you know, limit the rate at which the spread happens. Will definitely help our healthcare providers be able to continue to provide the same quality care that they're providing now in Hampton Roads. Great. Thank you.
So what's next on the agenda for you?
Are you off, Dave?